The Northwest Health Department and traditional health practitioners have yet to solidify their relationship, but mechanisms of cooperation are currently being finalized, and it could not happen soon enough. A World Health Organization indicates that 80% of Africa's population rely on traditional medicine for their basic health needs.
There are challenges in this world whereby you find that people demonize these traditional uses. But now there is an act which allows the THPs to work properly. But now as the registration is on, because remember, there must be some policies, there must be some regulations and all those stuff.
The health department acknowledges the role traditional healers will play in assisting medical doctors to cure many ailments.
You'd know that we are faced with many challenges, particularly TB and HIV. The understanding of traditional practitioners of these two particularly diseases were important for us to be trained on.
Residents are also keen on the idea. In most cases, some of the patients refuse to seek help from healthcare facilities but opt for traditional healers.
Sometimes you will have a problem with a child and go to the hospital to seek help. When you get there, the doctors fail to assist the child. Instead, you could have been assisted by the traditional healer.
Traditional healers want young people to be educated about indigenous herbs and reduce their reliance on Western medicine. Zebulon Maine, SABC News, Vryburg.
Well, let's chat more about this now. And just yesterday, of course, was African Traditional Medicine Day. Phepsile Maseko, who's the national coordinator at the Traditional Healers Organsition, joins us now. Thank you very much for your time, Phepsile. I mean, the clip that we've just seen, is this a step in the right direction?
Yes, thank you very much. Firstly, let me just thank you for, taking your time to invite us to studio. It is very much, important. It's quite relevant. Remember, incorporating traditional health practice, it is something that we have fought for many years. It is something that never came easy to government. We had to put a lot of pressure on ministers of African states. As a result, in 2010, a declaration, a Lusaka declaration for incorporating African traditional medicine into the mainstream health system of African countries was then taken up there. And unfortunately, a lot of countries, including South Africa, has not done much, in ensuring that most of the resolutions from the Lusaka declaration were adopted and implemented. But in any case, we are hopeful that, we are constantly going to put pressure on government to ensure that it's not just only Northwest. And also, Northwest, we are looking at the Northwest case because we hope that Northwest is not going to involve traditional healers only just on HIV and AIDS. Okay. We want traditional healers to be involved in the whole program, primary health care program, and probably beyond primary health care, because if they're only involved in just only matters of HIV and AIDS, then it means traditional health practitioners are again, made a conduit belt, right, to assist in providing, a workforce for just only HIV and AIDS and TB issues. We wanted to go beyond HIV and AIDS.
Is there any clarity, for example, on the issue relating to the Northwest about the involvement, the extent of the involvement of which is of concern to you?
One thing that we know, we've noticed with not just only Northwest, also KwaZulu-Natal said the same thing. The provinces are very quick to go to media, and yet to find that the toolbox itself is not well tightened up. Right. Toolbox, I'm talking about putting in place policies and provincial legislations. And those provincial legislation, remember, they cannot be divorced from the national legislation. Yes. Currently, we don't have a law that speaks about traditional health practitioners, being able to administer traditional medicine as traditional medicine. Traditional medicine is only regulated by the Medicines and Related Substances Act, which is Act number 101 of 1965, which is an act that is very problematic, because it does not necessarily give, adequate powers and recognition to traditional medicine.
Yeah.
It only gives powers to allopathic, which is Western medicine, and also to complementary medicine. But again, with complementary medicine, it runs very short. Complementary medicine is not adequately promoted and protected in the country. So that is why we are constantly in talk with government to say, let complementary medicine, let African traditional medicine be elevated so that people that want access to treatment in those areas are able to get, are able to get respect.
Yes.
They are able to also be treated with dignity and also be respected that they've made a choice to these two sciences.
Why is it, Phepsile, that we still see so much push and pull when it comes to the issue of Western medicine and African traditional medicine? I mean, if we look at, for example, what the World Health Organization is indicating, saying that about 80% of Africa's population relies on traditional medicine for their basic health needs. And why do we still find ourselves in this situation where there's still so much push and pull and what seems to be somewhat still a lack of that final synergy that needs to come together?
It's a multiple areas of challenges that we faced with.
Yeah.
Firstly, it is that Western medicine does not want to appreciate that we exist. I think political will as well, has to be blamed for all of this, because even if pharmaceutical companies do not appreciate that we exist, but we need to put in place politicians that are able to understand that people of Africa, they want to be treated in a culture, in a religion that best understand them. The fact that Africans are multi-religious people, it does not necessarily mean that traditional medicine should be given a secondary standard. I mean, let's look at the situation that is happening today. Obviously, we are happy that we're seeing a lot of developments in innovation, in traditional medicine research from the Department of Science and Innovation. But that department alone, I mean, what they're doing is not adequate. We need to see them being given, allocated lots of funding so that a lot of research gets to happen, so that we are able to, to come up with lead drugs from our knowledge, and also ourselves as knowledge holders, we are not left out from the entire development of our traditional medicine. But then what we're seeing often happens is that research councils are the ones that are wanting, like, I mean, let's make an example of the Vaal situation.
Yes.
The University of Vaal, wherein you find that it's the university and its subsidiary company, which wants to benefit from traditional medicine, from exploiting our knowledge. They bring together healers, exploit their knowledge, and the next thing, healers are there. They only include them in as far as knowledge is concerned. But then in terms of shareholding, in terms of beneficiation, they don't do those things. So you can see that most of these laws that are passed, they are more racist laws and laws that continue to undermine traditional medicine. But what we want to see is that we want to see traditional medicine elevated to a situation where it is at par with all other sciences.
So the Northwest case is not your perfect case study. A lot of work still needs to be done. And, I have to ask, Ma'am Phepsile, I mean, for example, what doesn't help is those who do wrong things, those who kill in the name of traditional, of doing things traditionally. I mean, we saw the case in Mpumalanga just a few days ago where a man was sentenced, a heavy sentence for using or basically killing someone under the guise of wanting to use the body parts for muti. Those are some of the instances that we still see, and possibly some of the challenges as well that would struggle to get rid of some of the stereotypes.
It is so unfortunate. I know that media is bound to look at just these weaknesses in the profession, which obviously you need to, to make sure that you warn us about and all of that thing. But it's so unfortunate that each time when you celebrate traditional medicine and the benefits thereof, we are always told about the negative things, and which is something that is not necessarily, which we don't necessarily see happening with Western medicine. We know that Western medicine also has its own baggage, but then we're not told and reminded how much of misconduct happens there. When they're promoting HIV and AIDS, we are not told of how much toxic drugs are, but we are told of how much beneficial they are, which is a story that we'd like to hear. Let us do the same thing here, where media should also play its part to promote us, and where obviously where we have done wrong, we appreciate we have done wrong. I mean, obviously it is wrong of us to to ever tell anyone that they'll get richer, they'll succeed better if they kill anyone. You know, when you come out of a petlweni, you are told by your kobela that you are not supposed to, you know, live off someone's human tissues.
Yeah.
You know, it is nowhere in the encyclopedia
Yeah.
of being a healer. You
But
know,
I
these
guess
are things that are
goes-
done by,
Yeah,
people that misconduct.
But I'm sure this is part of, I would concur with you certainly on what you've just said, but I'm sure this is part of the process as well in terms of education, in dealing with some of the negatives. While we appreciate the positives, there's negatives on both sides of the front, of which, of course, you also need to deal with as an organization, because the stereotypes are there and, some of the bad things as well are there, but it's part of the education process as well. We can't shy away from that.
Of course it is part of the education process, and that's why we're thankful to you, 404, that you're able to put together this a program like this, because this is part of advocacy. We are responsible for ensuring that if there's any bad name that goes out there in our status, we have to make sure that we clear those things. So we appreciate this very much, and we'll continue like we did yesterday, where we at Val with other healer organizations, where we're educating people about the benefits of traditional medicine, and obviously continuing to say we don't have to be exploited, and healers that are not conducting themselves ethically, we would need to punish them. And the Traditional Health Practitioners, the Traditional Healers Organisation's Code of Ethics and Behaviour Policy, which we have crafted very well, understanding human rights of people, will deal with all of those issues.
And I hope to have this conversation with you again very soon. Thank you very much for your time. Phepsile Maseko, who is the National Coordinator at the Traditional Healers Organsition.